Hello, I'm David Green, CEO of the Florida Pain Network, where we connect those in pain with pain relievers around the state, including Florida pain clinics, chiropractors, and physical therapy practices. Today the topic is vertebroplasty. What is it, why is it done, and what are the outcomes from the procedure? Well, millions of people around the country have osteoporosis now, which is where the bone mineral density of your bones, your wrists, your spine, your hip, starts to decrease. And at a certain point, that can predispose people to fractures that they wouldn't otherwise normally have. So if you fall down on your wrist and you're in your 20s, 30s, 40s, normally, big deal, you don't break your wrist unless the force is too high. But when you're in your 70s and 80s and you have osteoporosis, even a small little slip can cause that bone to break. Same with your hip, same with your spine. I know people who have simply sneezed and gotten a compression fracture in their back because the osteoporosis was so severe. In addition, there are patients with cancer such as multiple myeloma where it goes to the spine and can cause compression fractures. What are the treatments available for that problem? The first treatment is medication. Medication would be either Tylenol, anti-inflammatories, narcotic medication, muscle relaxers that can cause some spasms in the back. And that may be extremely helpful because over time, the pain will slowly go down, okay? Eventually, some bracing was developed, and those braces consist of either a Jewett brace or what's called a TLSO. And those can be a little bit bulky. They put pressure here, and then on the back in a couple places, and then down. And they can sort of make you sit upright or stand upright and can decrease pain nicely, okay? So that can help a lot. In the 1990s, the procedure called vertebroplasty was developed, and that is where bone cement is liquidy and it's injected into the fracture, and over a period of about 20 minutes, it hardens up and stabilizes it. It's like a cast on the inside. And the pain relief is like that. Over 95% of people get rid of most of their pain. It's dramatic and quick, okay? The risks of the procedure are small, but real, okay? And the patients go home the same day. So there are plenty of pain clinics in the Florida Pain Network who offer vertebroplasty procedures along with the medication management. And at times, a vertebral compression fracture can cause irritation of one of the or multiple nerve roots that are coming out from either the thoracic area or the low back. You know, pain can come around the front. So an epidural steroid injection might be a benefit as well, okay? So you start talking about medications, a trial of bracing to see if that's going to work and help, and then the vertebroplasty or maybe the epidural steroid injections. So all of those things can be done at a pain clinic in the Florida Pain Network. So check out the network today at floridapainnetwork.com. Click on I Need a Pain Doctor and the closest ones to you will show up. I'm David Green, CEO of the Florida Pain Network. Your pain stops here.